Okay, so picture this. You're maybe on your first clinical rotation, orthopedics. A young rugby player comes in hobbling, holding his knee after a bad tackle.
Classic scenario.
Right. And the attending pulls up his knee, MRI. And it's this incredibly detailed image, like a cross-section showing not just bone, but ligaments, cartilage, maybe even a tiny meniscus tear you just completely miss on an X-ray.
Absolutely.
And the question hits you, how? How do we get that level of detail from magnetic fields and radio waves?
Yeah.
How does physics turn into something so clinically useful?
Well, that's exactly the kind of question you should be asking. And it's really fundamental as you become a doctor. MRI, it's going to be just indispensable for you, especially, if you go into anything dealing with musculoskeletal health.
Right.
So this deep dive, it's designed to give you a really solid understanding, going beyond just spotting abnormalities to, grasping how it works, why it works, its strengths, applications, and really importantly, the safety side.
Exactly. It's not just about looking at the pretty pictures, it's the why and how behind them. So we've gathered some key resources for this. We're looking at a research article on clinical applications in musculoskeletal diseases, also a safety guideline document covering hazards and protocols, and some foundational stuff on the MRI principles themselves.
Good selection.
Yeah, the goal is really to pull all this together, give you a clear, practical understanding of MRI that you can actually use. Okay, so let's dive in. Fundamentally, what's MRI actually doing?
Okay, so at the core, MRI, magnetic resonance imaging, it uses these really strong magnetic fields and radio waves to create those detailed images. And a crucial point right off the bat for you as a future clinician, it's non-invasive. And it doesn't use ionizing radiation.
No radiation, unlike X-rays or CT scans.
Exactly, which is a huge advantage for patients, right?
Yeah.
Especially if you need multiple scans over time to, say, track how a disease is progressing or how treatment's working.
Non-invasive, no radiation. Big plus. So how do the magnets and radio waves actually make an image? Where does the signal even come from?
Right, so the main signal source is the hydrogen atom,
Wow.
which, is everywhere in the human body, mostly in water and fat.
Water and fat, okay.
Yeah. So the MRI scanner itself has this incredibly powerful magnet. When you go inside that magnetic field, the hydrogen protons, those are the positively charged bits in the hydrogen atoms. They all line up with the field.
Like tiny compass needles?
Kind of like that, yeah. All pointing the same way. And they also start to spin or wobble in a specific way. It's called precession, like lots of tiny spinning tops all wobbling together at the same frequency.
Okay, lined up, spinning together. Got it. What about the radio waves then?
Good question. So the scanner sends out these short bursts of radio waves, and they're tuned precisely to that frequency the hydrogen protons are spinning at.
Okay.
These protons absorb the energy from the radio waves, and bam, they get knocked momentarily out of alignment with that main magnetic field.
Just temporarily.
Just temporarily. And here's the really cool part. When the radio wave pulse stops, these excited protons, they don't just snap back instantly. They gradually return. They precess back into alignment. Think of that wobbling top slowly settling down. And the key thing is, hydrogen protons in different types of tissue, like muscle versus fat versus water versus cartilage, they return or relax back into alignment at different rates.
So the scanner is actually detecting those different speeds.
Yeah.
That difference is how it tells tissues apart.
Precisely. The scanner has these super sensitive detectors that pick up the tiny differences in the energy the protons release as they realign. And they're also gradient coils.
Gradient coils.
Yeah, these create tiny localized variations in the main magnetic field. By switching them on and off really fast, the scanner can basically figure out where in the body the signals are coming from, spatially encoding the signal.
And is that the loud knocking noise you always hear during an MRI?
That's exactly it. That thumping or knocking is the sound of those gradient coils rapidly turning on and off, doing their job. It sounds a bit alarming, but it's just part of the process.
Huh. Always wondered about that noise. So, okay, the scanner gets these signals based on how fast the protons realign.
Yeah.
And then how does that become an image we can actually look at and interpret?
Right. So the raw data is just this complex mess of signals. It then goes through some heavy-duty computer processing. Sophisticated algorithms analyze the signals, their strength, their frequency, where they came from.
Okay.
And by looking at those different relaxation rates from different tissues, the computer reconstructs these detailed cross-sectional images, slice by slice. And you can view these slices in different planes, like looking from the side, the front, or crosswise. Gives you that full 3D picture of the anatomy.
That's a brilliant overview of the basics. Really helpful. Now let's zoom in on why MRI is, well, so good for the musculoskeletal system. X-rays are still key for bones, right? So what makes MRI the go-to for muscles, ligaments, joints?
You're absolutely right. X-rays are still vital for bone visualization. They work based on dense bone blocks, X-rays well, but they really struggle with soft tissues. Muscles, ligaments, tendons, cartilage, they just don't show up clearly on an X-ray.
Right.
And that's exactly where MRI shines in musculoskeletal imaging. It overcomes that limitation. It lets us see those soft tissues directly with really exceptional clarity and detail.
So it's not just is the bone broken, it's also what's happened to everything around the bone.
Exactly that. MRI gives you this comprehensive view. You can see the muscles, the ligaments, the tendons, the cartilage, even the bone marrow inside the bone. This capability is just a massive leap forward for diagnostic accuracy.
Yeah, I can see that.
Think about common injuries. A torn muscle, a sprained ligament, damaged cartilage. These are mostly soft tissue problems. They might be subtle or totally invisible on an X-ray. But MRI, it can clearly show you the extent, the location of that injury.
That's incredibly useful, thinking back to that hypothetical rugby player.
Mm.
So MRI tells you not just if there's an injury, but how bad it is, and if anything nearby is also affected.
Precisely. And a big reason it can do this so well is its ability to differentiate between different types of soft tissue. It gives you what we call high contrast resolution.
High contrast, meaning it makes different soft tissues look distinct.
Yes. Different tissues have different amounts of water, different chemical makeups, and that affects how their hydrogen protons behave in the magnetic field. MRI sequences, the way we run the scan, can be specifically weighted or tuned to emphasize these differences. That makes it easier to tell, say, a healthy ligament from a torn one or healthy cartilage from damaged cartilage.
Okay, so MRI, the champion for soft tissue.
Got it. Let's talk clinical applications then. How does this actually help us diagnose and manage patients with musculoskeletal problems? Give me some key examples. Sure. Let's start with sports medicine. Very common area. Like we said with the athlete example, MRI is just invaluable for assessing acute injuries, muscle strains, ligament tears, joint sprains, all common in active people.
Right, like an ACL tear in the knee.
Exactly. An MRI can clearly show that torn ACL, but also any associated damage, maybe to the meniscus, maybe some bruising in the bone itself. An X-ray might only show you if there's a fracture alongside it, if you're lucky.
Okay.
But the MRI reveals the full picture of the soft tissue damage. Are blood vessels involved? Nerves? Is there bleeding in the joint? Getting all that detail is crucial for planning the right rehab program and getting the athlete back safely.
Makes sense. Essential for return to play decisions. What about more chronic, long-term conditions?
It's just as critical there. Think about diseases like rheumatoid arthritis or ankylosing spondylitis. MRI lets us track how the disease is progressing over time. We can see if treatments are working. And importantly, it can detect early signs of joint damage, like inflammation in the joint lining synovitis or tiny bone erosions. Often way before you'd see changes on an X-ray or even notice them on a physical exam.
Wow, so catching things earlier.
Yes. And for patients with chronic pain, maybe back pain or joint pain, MRI helps pinpoint the underlying cause. Is it inflammation? Is it degeneration, like cartilage wearing down in osteoarthritis? Is it some ongoing soft tissue damage?
And you mentioned osteoarthritis specifically.
Yeah, studies show MRI is really effective at assessing things like bone marrow edema and osteoarthritis. That's basically fluid buildup and pressure inside the bone marrow, often a big source of pain. MRI can also show subtle, early changes in the joint cartilage itself, again, before X-rays might pick it up. And those high-field MRI scanners we'll talk about later, they're even better at spotting the really small joint problems you see in conditions like rheumatoid arthritis.
So not just for big injuries, but also tracking those subtle, slow changes in chronic diseases. That's powerful.
Absolutely. And it doesn't stop at diagnosis. MRI is vital for treatment planning and monitoring, too. Orthopedic surgeons use pre-op MRIs as a detailed map, basically. It shows the extent of the damage, helps them plan the procedure meticulously.
Like a surgical roadmap.
Exactly. And then post-operatively, MRI can check how well the repair has healed, track the healing process, and guide changes to the rehab plan if needed.
You mentioned a study earlier that looked at the impact of MRI on treatment decisions. Can you tell us a bit more about that?
Yeah, that was an interesting one. It involved 200 patients with various musculoskeletal issues. They basically compared the initial diagnosis and treatment plan with what the MRI showed, and then looked at what treatment the patients actually received.
And what kind of MRIs were used?
They use standard clinical scanners, either 1.5 Tesla, that's 1.5 T, or 3 Tesla, 3T. Those are the typical strengths you'll find in hospitals. Like here in Ireland, Children's Health Ireland has multiple scanners at those strengths.
Okay.
And they use standardized protocols with different image weightings. T1 weighted images, which are great for looking at anatomy and bone marrow. T2 weighted images, which are very sensitive to fluid and inflammation, so good for pathology. And proton density weighted, which gives excellent detail of structures like cartilage.
So what did they find? How much did the MRI results actually change things for those patients?
The impact was pretty substantial. After the MRI results came back, there was a 25% increase in patients going for surgery.
So MRI identified more cases needing surgery.
It suggests that, yeah.
Yeah.
It likely showed problems that were more significant or more suitable for surgery than initially thought just from the clinical exam. But here's the really striking part. There was a 133% increase in referrals for rehabilitation, like physical therapy.
Wow, 133%. That's huge.
It really is. It dramatically underscores how MRI doesn't just lead to more surgery. It often provides such detailed information about the specific problem that it allows for much more targeted, non-surgical treatment, like tailored physio. It fundamentally reshapes the treatment strategy based on a precise understanding of what's wrong.
That's fascinating. A huge jump in rehab referrals really highlights how it guides towards potentially less invasive options, too. Okay, looking ahead now. Tech is always moving. What advancements are happening in MRI itself?
Oh, there's some really exciting stuff happening. One big area is high-field MRI. Scanners operating at 3 Tesla 3T are becoming more common, and there are even 7 Tesla 7T scanners, though they're mostly used for research right now.
Like we said, 1.5T and 3T are the main clinical ones here.
Exactly. And the main advantage of these higher field strengths, you get better spatial resolution, sharper images basically, and a better signal-to-noise ratio.
So clearer pictures, more detail.
That's the idea. Think of it like upgrading from standard definition TV to high definition. You can see finer details, more subtle abnormalities. This is particularly helpful for imaging small structures, like in the hand or foot, or looking at deeper tissues.
Makes sense. Sharper is better. What else?
Well, there's also contrast-enhanced MRI. This involves injecting a special contrast agent, usually gadolinium-based, into the patient's vein.
Okay.
This agent highlights areas with increased blood flow or where blood vessels might be leaky. It can really help make certain things stand out, like tumors or areas of active inflammation. And then there's functional MRI, fMRI, which looks at brain activity by detecting changes in blood flow. Not really musculoskeletal, but shows the technology's versatility.
Right. And you mentioned earlier that interpreting these complex images can be challenging. Any tech helping with that?
Absolutely. AI artificial intelligence is making big strides in image analysis. Machine learning algorithms are being trained on massive data sets of MRI scans.
How does that help?
The idea is they can assist radiologists, maybe by highlighting suspicious areas, potentially spotting subtle things the human eye might miss, or even helping to quantify changes over time, like measuring the size of a lesion on serial scans. It can make interpretation faster and potentially more consistent.
So AI could help tackle the complexity and maybe even the time and cost involved.
That's the hope. It's still evolving, but AI definitely holds a lot of promise for enhancing MRI interpretation and ultimately benefiting patients.
That sounds like a really promising area to watch. Okay, so we've covered the how it works and the what it's used for. Now let's pivot to something absolutely crucial for you, the future doctor, safety. MRI machines are incredibly powerful magnets, right? Safety protocols must be non-negotiable.
You are absolutely right. Paramount importance. The main thing to remember is that strong magnetic field. It's always on, 204/7.
Always on. Unlike an X-ray machine that only produces radiation when it's taking a picture.
Exactly. That constant, powerful, static magnetic field creates unique and significant hazards. You absolutely have to be aware of these when you start referring patients for MRI.
Okay, so what's the #1 safety concern with that big magnet?
The biggest risk is the incredible force it exerts on ferromagnetic objects. Things containing iron, nickel, cobalt, they get pulled towards the magnet powerfully.
You mean like things flying across the room?
It sounds dramatic, but yes. If a ferromagnetic object like an oxygen tank, a wheelchair, even smaller things like scissors or keys gets too close, it can become a projectile. It gets sucked into the magnet bore with tremendous force and speed. That's incredibly dangerous for anyone in the way, especially the patient inside. Serious injury, even death is possible.
Okay, so big metal things are a definite no-go near the scanner room.
Definite no-go. But it's not just the big stuff. Smaller items too, keys, hairpins, pens, even some pagers are tools. That's why screening everyone who enters the MRI scan room, patients, staff, visitors, is absolutely mandatory, no exceptions.
And I know certain medical implants are a huge issue too, right?
Yes, a major concern. Some implanted devices are absolute contraindications for MRI. Think cardiac pacemakers, implantable defibrillators, ICDs, certain neurostimulators, some cochlear implants.
Why are they contraindicated?
The magnetic fields can cause them to malfunction, heat up dangerously, or even physically move inside the patient. Huge risk. So, identifying patients with these devices before they even get referred for an MRI is critical, unless, of course, it's a specifically designated MRI conditional device, and very strict protocols are followed.
Okay, so as the referring doctor, what's my specific responsibility here? How do I help prevent these issues?
This is a really key part of your job. Safety guidelines state clearly it's the referrer's responsibility to identify potential contraindications before you send the referral.
So it starts with me.
It starts with you. You need to take a thorough patient history. Ask specifically about any implants, any prior surgeries with metal clips or screws, any chance of metal fragments in their body, like from welding or an old injury tattoos with metallic ink, anything relevant. Your careful history taking is the first and arguably most crucial safety step.
Got it. Ask the right questions, document everything. What happens when the patient actually gets to the MRI department? What checks happen there?
When they arrive, the patient and anyone going into the room with them has to fill out a detailed MRI safety checklist. It asks very specific questions about metals, implants, devices, past procedures.
Okay.
And then trained MRI staff, usually called level 2 MR personnel, must review that checklist carefully with the patient, make sure everything's understood, answered accurately. It's a vital second layer of safety screening.
And why do patients always have to change into a hospital gown, even if they swear they're not wearing anything metal?
Ah, yes, that's non-negotiable. Absolutely essential. Patients must change into an MRI safe gown. There are a couple of big reasons. One growing worry is microscopic metallic fibers woven into clothing,
Metal in clothes. Like what?
especially in sportswear. Stuff marketed as performance or anti-odor, they often contain silver or copper microfibers. You can't see them.
And that's a problem
Because those tiny metal fibers can act like little antennas in the MRI's radio frequency field. They can heat up significantly, enough to cause serious skin burns.
wow, burns from clothing? You wouldn't even know the metal was there.
Exactly. Often the clothing labels don't even mention it. There are documented cases of patients getting burns from things like jogging pants that had hidden metallic fibers. So the only truly safe approach is to have everyone change into a tested MRI safe gown. It eliminates that hidden risk.
Makes perfect sense. Better safe than sorry. What about inpatients coming down from the wards? Any extra precautions for them?
Yes, preparing inpatients needs even more careful checking. They might arrive with all sorts of things attached: ECG leads, oxygen saturation probes, temperature sensors, IV lines, maybe even hospital blankets.
A blanket.
Believe it or not, yes. Some hospital blankets have metallic threads woven in for warmth. All these attachments need to be checked. Many standard hospital items are not MRI safe. Certain ECG stickers, O2 probes, IV components can heat up or cause artifacts. Everything potentially unsafe must be removed before the patient goes into the scan room.
That blanket example is startling. I read about a case where a blanket with copper fibers actually caused a fire in an MRI.
Exactly. It's happened. It highlights that the risks aren't just the magnetic pull. It's also heating from the radio frequency fields and induced electrical currents. And we also have to think about things the patient might not tell us about or even know about.
Like what?
Like maybe they swallowed a coin or a child swallowed small magnets. Undeclared internal metal. To catch things like that, most MRI units now use ferromagnetic detectors, walk-through ones, like at airport security, and handheld wands to screen patients before they enter the magnet room.
Ah, like a final metal check.
Oh, yeah.
Okay, now you mentioned implants earlier. I recall a really concerning case report about a patient with a deep brain stimulator, a DBS, who had an MRI. What went wrong there?
Yes, that was a tragic case. It really underscores the potential for severe harm if safety guidelines aren't followed meticulously with active implants. This patient had a DBS for Parkinson's, underwent an MRI, and suffered irreversible major neurological damage as a direct result.
How did that happen?
The main theory is something called the antenna effect. The long wires or leads of the DBS system can essentially act like antennas in the MRI's radio frequency field. They absorb that RF energy, which then gets concentrated and causes significant heating at the electrode tips deep inside the brain tissue.
Devastating. So what are the rules if an MRI is absolutely essential for someone with a DBS?
The device manufacturers have very strict, very specific guidelines. Generally, MRI is considered contraindicated unless absolutely necessary and done under tightly controlled conditions. If it has to be done, it's usually at a lower field strength, like 1.5 T, if possible.
Okay.
The patient needs full counseling on the risks. The scan must be supervised by an MRI-trained radiologist or physicist with specific DBS expertise. The DBS system itself usually needs to be programmed into a special MRI mode, often turned off completely. And typically, only a specific type of head coil, a transmit-receive RF head coil, can be used to limit the RF energy exposure to the device. Plus, there are strict limits on the specific absorption rate, which measures RF energy deposited. Following those manufacturer guidelines to the letter is absolutely critical.
So it's incredibly specialized, requires a whole team, specific settings, constant vigilance. What about patients who are unconscious or need general anesthesia for their MRI?
Right. MRI under GA brings its own challenges. Standard anesthesia machines, ventilators, monitors, they usually have ferromagnetic parts. Can't go in the room.
So you need special equipment.
Exactly. You need specialized MRI conditional ventilators and monitoring equipment. These have been designed and tested to be safe and functional within the high magnetic field environment. Allows safe monitoring and support for the patient throughout the scan.
Okay. It really strikes me how crucial communication is across the board here, from the physics to the scan to the safety checks.
Absolutely. Clear, thorough, timely communication is the foundation of safe and effective MRI. It starts with you, the referring doctor, providing that complete history and flagging any potential concerns on the referral.
Right?
Then the MRI staff rely on that, plus their own detailed screening and talking directly with the patient to ensure safety in the suite. And explaining things clearly to the patient is vital too. Why the checks, why the gown, what to expect. It builds trust and ensures cooperation.
This has been incredibly helpful, getting that deeper understanding of the physics behind the images, and especially the absolute necessity of those safety protocols. It really sticks with you. As I move forward in my training, what's the single most important takeaway message about MRI I should keep in mind?
I'd say the most critical takeaway for your practice is this. MRI is an incredibly powerful tool, especially for soft tissues and musculoskeletal conditions, no doubt about it. But its safe and effective use absolutely depends on understanding the principles, the applications, and maybe most importantly, the hazards and the safety protocols. They must be followed diligently without fail.
And my role in that.
Your role as the future doctor in identifying potential risks before the patient even gets near the scanner. That proactive step is absolutely essential for patient safety. It prevents harm.
That's a really powerful message. I'll definitely carry that forward. And it's fascinating to think about where it's going next, those advancements in tech, AI helping with interpretation, how that might change things even more.
Indeed. The field is definitely not standing still. It's constantly evolving, which promises even better diagnostic tools down the line.
So a final thought then. It's easy to just see the MRI scan as, the end result, the picture. But as we've really dug into today, it's so much more. It's this complex interplay of physics, amazing technology, and human expertise from the referrer to the technologist to the radiologist. Your understanding of all those pieces is going to be absolutely crucial for giving your patients the best and safest care possible. So thinking about your own path, what questions does this deep dive spark for you about using MRI or ensuring safety in this specific field you hope to practice in?